Hello, Facebook viewers. Coming to you from Dentsply Sirona World 2017. My name is Don Hobbs. I'm with Henry Schein, and I'm sitting here with my good friend, Dr. Bill Bush from North Kansas City Dental, also a partner of mine in what was a very long relationship on the Team Smile board that we'll spend a couple minutes on at the end. But I was hoping, Dr. Bush, we could talk about your practice a little bit and how you bring all the great tools that Dentsply Sirona brings to the dental community and how you use them in your practice.
Well, I started back in 1989, so I'm almost going to get ready to celebrate my 30th anniversary here soon.
Fantastic.
And way back when, in 89, 90, I had the vision of kind of the digital practice, but at that time, things didn't really exist. Back in 93, I added our first digital component, which was digital x-ray. Back then, it was Trophy.
Wow.
And
so
then,
you're a true pioneer. Did you have practice management at that point too?
At that point we did, but the company that had this vision went out of business, and then I had always kept my eye on Dentrix, which I've been a big fan of, and in 1998 we added that to our practice. But the biggest thing I think any practice needs to make is make the practice management choice the best it can be, because that's going to be the backbone for everything you do in your practice.
Right. Fantastic. So in addition, you started with just regular intraoral digital x-ray, practice management. I know you've now evolved to the full Conebeam, digital impressioning, multiple CAD/CAM systems through the practice. Can you talk a little bit about that?
Sure. And then as far as the progression goes, then we added intraoral cameras, which would help us talk to patients about their needs.
Good call.
And then from that point, we went to CAD/CAM in 2001. And that was a big year because that was the year it went to a Windows environment. If you were somebody that liked DOS, which was pretty difficult with CEREC 1 and 2 and 3, before it went 3D, it was very difficult to use. It was kind of a labor of love. 2001, we went digital with the Windows environment, so anyone in our practice could pick up and learn it. And that was a big milestone for me, was adding that. Then following that, we added Conebeam technology when that came out, and haven't looked back at the workflow. Has just been extremely efficient, fast, and accurate.
Is that where the Conebeam really fits in, is the accuracy? Is that kind of like, we hear the term gateway product oftentimes used. Is that pretty accurate?
I would agree with that. I kind of call it a GPS for your practice, because once you can take one image,
great analogy.
It gives you a great 3D view of the whole landscape of the mouth, the hard tissue, and soon to be probably soft tissue, endodontics, orthodontics, crown and bridge, implantology. It just gives you very, very many options just from one purchase.
So once you take the initial scan on a patient, take me through the steps. When does the new scanners that we hear so much about come into play? How does that affect the patient flow?
Well, we're really excited because we're going to add the digital scanning to every new patient. So we're going to merge the impression or the digital impression, because so many times my patients would look at me and they'd look at the Dentrix chart and say, are those my teeth? And I'd say, well, they're just paintings of your teeth, drawings, but not really your teeth. And then they would kind of retract themselves a little bit. But now that we have the digital impression taking systems and combining that with the Conebeam technology, they can actually look at their mouth and their face like an anatomy book, where you just turn the page and then you see the next layer and you can look at every little piece of information that the patient has.
It really makes it real for the patient,
doesn't it? They take ownership, almost immediate ownership. Treatment that they otherwise wouldn't get, they're starting to do now because they're selling themselves. They ask me the questions, what's next? I'm not telling them what to do, they're asking me what they should do.
Wow, that's fantastic. So I have to ask one last thing. In addition to this practice, you have a very successful, very big practice. You treat a lot of patients. And in your downtime, where most people do whatever it is their hobby is, you've created something called Team Smile. Can we take a second to tell us a little bit about that?
Sure. I started Team Smile back in 2006, 2007, after I got inspired by, I'm sure everybody's heard of Diamante Driver, a 12-year-old who passed away from not having his primary tooth extracted that was abscess.
Incredible story.
And it moved me and motivated me to try to do something different in the community that would excite not only our volunteers, but the kids that we serve. And I thought, let's call it Team Smile. Let's use the power of professional sports to motivate these kids. And I'm a firm believer that the fabric of every community are their sports teams.
Yeah, you're right.
So we're going to wrap dentistry around that may seem unpleasant to some people, around a fun experience. And it's been proven to be a great formula. We've been doing this now for 11 years. We're in about 18 NFL teams. We've got about 8 to 10 Major League Baseball teams, soccer, basketball, hockey, and even golf.
Oh, fantastic.
So each sport, doesn't matter what sport it is, we just kind of mix the dentistry in there, and the kids just have an experience that's makes their smiles big, but also makes them fans of dentistry for a lifetime.
The world would be a better place if there were more people like you, Dr. Bush.
Thanks, Don.
Thank you so much from Dent Supply Sirona World 2017.